NSFW, what was your most embarrassing trip to the doctor? Went to the ER for stomach pains, worried about appendix, spleen, gallbladder etc. I was constipated. My brother still tells the joke that the one time I went to the doctor I was full of shit. That's super common actually. They for sure forgot about you the minute you left. When I went to law school, I had to take an exam to ensure I had my immunizations and for a physical check because I was going to live on campus. The very young nurse walked in, I handed her the form, and we started the exam. Height, weight, blood pressure, all of that. I'm sitting in the chair and she's going down the form reading it aloud, and as she's ticking off the items she says, and I'm going to need a sperm sample, very casually, and reaches back and hands me a sample cup. There's a bathroom 2 doors down, and when you are done just bring it back in here. I hadn't had a physical or medical exam in years, and so I didn't know. I got very quiet, but she was very professional about it, so I got up and took the cup to the bathroom. See the room. A small, all-white clinical bathroom, a toilet, a sink, a mirror, a medical waste trash can. No, stimulation so to speak. I begin the process of trying to excuse me wank my ejaculate into a cup. Lots of hard imagining something sexy while tightly shutting my eyes in this extremely bright room. After about 10 minutes, as I was starting to ramp up, she knocks on the door and says, "Are you okay in there?" I awkwardly say, "Yes, one moment," and she leaves. Eventually after a few more minutes I squeak out my reward, and sheepishly walk back to the examination room and place my cup at the table. She is sitting there filling out the form and says, "Okay, just a couple more items, and then we can get you a tetanus shot, because you are due," and then She stopped because at that moment she glanced at the cup, wheeled her chair over to the table, picked up the cup, looked into it, took a long pause, and turned absolutely red. "I'm so sorry, I meant a urine sample." I would have jumped out the window. I had a cyst on my upper butt crack for the better part of a month. One lovely Saturday morning it's gotten so large and swollen that I couldn't even walk or sit down without crying in pain. I'm the first person to the urgent care that morning and find myself laying sideways on a table with a lovely doctor using a scalpel to force an eruption of the volcano that had formed between my cheeks. It was instant relief and used probably 20 pieces of gauze to clean up. I'd say that one. Even worse than getting my balls ultrasound. My mom is an ultrasound tech. She complains that it always seems that the testicle ultrasounds always happen on her shift. Always a great conversation around the dinner table. Edit since this gained traction. You have to understand, medical professionals mentally kinda separate patients and their issues. HIPAA has kinda trained them to do this. When someone is getting an ultrasound, my mom doesn't really think of the testicles as being a part of the person, if that makes any sense. She's not holding and prodding around someone's balls. She's holding and prodding around an object that may be causing someone pain and discomfort. She wants to help people. When she is performing one of these ultrasounds, she doesn't feel like she is in an extremely intimate position that is usually reserved for romantic partners. She is trying to help the patient feel better. It's just like a broken arm to her. Making fun of a patient is the last thing she would do, and of the coworkers of hers that I have met, none of them would either. None of this stuff is out of the ordinary for them. It doesn't warrant much attention. I had one of these, but I kept ignoring it until it was bad. Had to go under anesthesia while they carved it out. 3 deep hole that I had to change parking for frequently. First 2 months of my senior year the school nurse had to bend me over after lunch and change my gauze. Bend me over after lunch and change my gauze. I can't keep up with all the new slang from you kids. I was about 15 and at the doctor's laying on that short table waiting for the doctor. I couldn't figure out why that dumb table was so short and tried to figure out a way to make it longer. Well, I realized at the end of the table there were these fancy leg extensions. So I pulled them out and waited. Doctor came in and started laughing hysterically and asked me what kind of exam I wanted. I didn't realize what I had done until 20 years later I went to the doctor's with my wife. Kind of a delayed embarrassment. Edit. I probably should include the part as to the look I had on my face 20 years later when it all came to me and I figured out what actually happened. I'm sure my wife was puzzled as to why I was laughing so hard while she was having her checkup done. I'm reading this while waiting in a doctor's surgery for a procedure involving those fancy leg extensions. I had a CAT scan for a kidney stone. Since that's all they were looking for in the notes it said penis. Unremarkable. I know it's not much but damn. I'm sure in someone's eyes your penis is astonishing. Valentine's Day, 2019. I pooped blood in the morning. and made an emergency appointment. My doctor is a 60-something-year-old woman, and she says to me, "You realize you can't tell me something like that without me having to take a closer look." I'm lying sideways on the bed with my knees tucked up and my pants pulled down. She applies ice cold lubricant and starts to insert a finger into my ass, and I make the awkward remark, "You haven't even taken me out to dinner yet." Dead silence. Nothing wrong as far as I can see. She tells me, "Have you eaten anything like beetroot recently?" I immediately remember the beetroot juice smoothie I had drunk the day before, but I'm too embarrassed to admit to it, so I lie. Worst Valentine's Day ever. OMG, that's ducking hysterical. It wasn't so much a trip as it was a phone call. My wife and I were trying to have a child without much success. One of the first steps on my end was to masturbate into a small cup, which was not easy, by the way. I learned I had to call a number on a card they gave us before doing this to let them know, because I have like an hour to get it to them. Awesome. Can't wait to inform someone I'm about to jack off. I call the number and they answer with "Hello." Great. Let's not make this easy. I decided they probably hear this 20 times a day and to be cool about it, so I said, "Hey, I was just calling to let you know I'm getting ready to masturbate and bring in my semen. Just wanted to let you know." I'm not exaggerating in the slightest when I say this person was taken aback, confused, and disgusted. She had no idea what I was talking about. The number on the card was no longer this company's, which I learned after my conversation with this woman. The ducking card with the number they gave me was not the right number. My wife and I still laugh about it till this day. I explained to this random person who had a new number why I disclosed this information after figuring out what just happened. I was actually pretty pissed at the company initially, but no, it was just a horribly unfortunate set of circumstances no one meant. Anyway, we have a 2-month-old son now, and coincidentally it was completely natural after years of trying. Hemorrhoids by far. I know women go through way worse at the gyno and IDK what I expected, but I was not prepared to lay on my side in the fetal position while the doctor opened my ass cheeks like he was about to read a book. This book is full of shit. I was pretty young, had never swallowed a pill before. My only experience with anything pill-like was Flintstone vitamins. I was in there with my mom and was given a Tylenol and a cup of water, and I guess no one imagined I had never taken a pill before, so I immediately popped it in my mouth and vigorously chewed, and then immediately threw up from the bitter taste. My reaction was surprise and confusion. Doctor was just like, "You just swallow them with the water." Like I was some damn idiot. For what it's worth, I swallowed not one, but 2 Pepto tablets. Ask my in-laws what sadist decided to shape the pills like little hockey pucks. The in-laws are kind folks, but could not hide the fact that they thought I was an idiot as they told me that the Pepto was, in fact, a chew tablet. Anal abscess. Went in to have it lanced, and the nurse was super hot. She was the one who ended up holding my butt cheeks open so the doctor could drain this massive disgusting cyst. Happened to me too, except the doctor knew that it was going to be really painful for me and took it as a good teaching opportunity. He brought in maybe 8 new doctors, not sure if interns or residents, just so they can watch me scream in pain for 15 minutes. A really cute female doctor came up beside me and held my hand the entire time and told me I could squeeze her hand if I needed to. The initial Percocet did nothing for the pain, so they shot me with hydromorphine, which was painful as hell. It didn't do anything for the pain either, but it stopped me from squirming, which helped the doctor. Afterwards, they stuffed the wound with this packing fiber stuff to keep it open. It fell out the next day though, so I had to go back to the ER to pack it again, and the person who did it was the same cute doctor who held my hand. Sadly, it didn't heal properly and formed a fistula. I met with a surgeon to see what to do about it, but was told that there was a chance that the surgery would leave me incontinent since they would need to snip my anal sphincter. I was only 26 at the time, and I couldn't be shitting myself for the rest of my life, so I declined treatment. For the next 2 years, I had to patch the fistula up with gauze and medical tape after every shower and poop. I thought I had to live the rest of my life like that until I looked up the best colorectal surgeon in the world and had a consultation with him. He was very confident he could treat me without causing incontinence, and so I finally got the surgery. It was successful, and after another 8 months of healing, I was back to normal. All of this came from using a sauna at the gym. I was sitting on a towel, and also had a towel wrapped around my butt, but 2 layers of towels weren't enough to stop whatever germs infected me. Thanks, I will never go to a sauna ever. The doctor asking me my name, date of birth, and then asked sex. As in male or female is what he meant, but at the time I was a little kid, so I got nervous, felt awkward, immediately turned to look at my mom, and quickly said no, I'm too little. All worried and shit, thinking I was gonna get in trouble, and they both just laughed at me, haha. Oh my god, that's so adorable. Kids are hilarious sometimes. Skin on my balls had the texture of dried cooked chicken skin and was flaky. Was informed I didn't have ball cancer, but I was masturbating too much. Edit. Till this isn't a well-known thing. Take care and moisturize your balls, brothers. 07. So, you just jank your dry ballsack to get off? Well, TMI, but it was the friction from doing it a lot. Cold country, lots of friction. I basically burned my bowel bag. I have a couple, but you can get a pimple on your dick. On the head, especially if you wrestle, and it's summer, and the gym doesn't have a shower, and you have to walk half an hour home. I had it examined by the head pimple dick urologist, and it was without a doubt 100% a pimple. Scariest few days of my life. Edit. Never in my life would I have imagined this would get this much attention. Young me would have never believed it. Thank you for the love and awards. If there's something strange on your junk, please see a doctor. I'm forced to wonder what causes a person, after 10 years of medical school, to choose pimple dick urologist as a specialty. In all fairness, he was like a big deal at the hospital, head of some department, and had a specialty in venereal disease. The way he explained it to me was that he could tell right off the bat it wasn't an ST, and he'd seen enough false alarms to know it was just a pimple. I was in another country and got chlamydia while there. I pretended to be my friend, so I wouldn't have to pay a fee to see them. My friend was married. They tried to call her husband to inform him his wife had an STD, and I told an elaborate lie about him knowing I had sex with someone because he likes to watch and not partake, so we weren't intimate and couldn't have gotten it too, so they wouldn't have to call him. IDK, what the duck, I was thinking, but the look on the 75 years old doctor's face was hilariously horrified. I love how lies escalate to bigger and weirder lies, at which point there's no going back. An aurora borealis, at this time of the year, at this time of day, in this part of the country, localized entirely within your kitchen. Can I see it? Found a small lump on the left testicle. I went to see the urologist, and when the nurse brought me to the room, inside there was a doctor with around 20 students. Doctor told me to lie down on bed and take my pants and underwear off, and not to worry about students, how they will be doctors one day as well. He put the gloves on and proceeded with the exam, trying to find the lump by moving his fingers around my left testicle. After he finally found it, he called the first student and told him to look for the lump. Every single person in that room was touching my balls. That was weird as F. Edit. That was 20 years ago in Eastern Europe. You had no choice, lol. And more than half of the students were girls. They ran a train on you, man. I was like 9 and my mom had some brownish lipstick. Well, as a prank I put in on my underwear and walked around the house with my pants sagging. Forgot about it, and that night I got up to go pee, and when I went to lay back down the spring popped out of the bed and cut my side really bad. I get to the hospital and remember about the underwear after they asked me to change into my gown. I didn't want to have my bare ass sticking out from the gown, so I kept the underwear. After they stapled me up, they asked my mom to leave, and they asked me again what happened. Guess they seen my fake poo stained undies with blood on it and was like, what's going on in that house? My mom was pissed, but we laugh about it now. Your pranked Yule Mayo. A couple of days after my vasectomy, my balls swelled up like tangerines. The whole area, scrotum to butthole, turned purple black. I had to go to the emergency room and show it to the triage nurse. Then every nurse that came to check on me while I waited. Then 2 doctors. Then what seemed like every nurse that happened to walk by my bed for the next couple of hours. Did it get weirder when other patients came to have a look? You know it's bad if the janitors have a peep. When I had to show my naked butt to the doctor in the hospital, and she spread my butt cheeks to look inside, and then a dozen student doctors interns came in the room and were all staring at my butt for what felt like hours. Oh my god, I would have been sweating buckets. I was getting ready to go to a BBQ/pool party, changed into my swimsuit, put clothes over it, and I was doing chores before I left home. My face started feeling numb and I was getting a headache. Called the advice nurse. She told me to call for an ambulance. Paramedics come, transport me to hospital, check into the they do an exam, CT scan, and labs. They find nothing and decide to discharge me to follow up with my regular doctor. While waiting for discharge paperwork, I'm sitting on a hospital bed in the hall. My neck is really aching from my halter-top swimsuit holding my boobs up, so I pull the strap over my head to relieve the pressure, and then it hits me. I'm fairly large-chested and my halter-top swimsuit was pinching a nerve in my neck and causing all the symptoms. I was too embarrassed to tell the doctor or nurses. I was too embarrassed to tell the doctor or nurses. Let's be real here. The medical staff should be way more embarrassed than you for not realizing the cause. Cut the flap of skin that connects my sack to the shaft of my penis with hair clippers. Not only was it a day that they were training new doctors, but also my mom worked for the hospital and saw my name on the computer system. So by the end of the visit, I had 5 extra young doctors staring while I got stitches, but also my mom walked into thinking something bad happened to me. Was that an accident during a trim, or like, to liberate it? I was about 22 and was having sharp pain during sex and bleeding afterwards and a stinging feeling when my boyfriend, now husband, ejaculated. It was scaring the hell out of me, but luckily I had a pap smear coming up. Unluckily my normal doctor was not available and my boss wouldn't let me take a different day off work, so I had to have a different doctor. I had no preference for a male or female doctor, and before this, I never had a bad experience with doctors. He came in for my pap smear and I explained the pain and bleeding and he said, oh, it's just dryness, and he blew me off. When I told him it happens when we use lube and the stinging sensation wouldn't be caused by dryness. I was a young woman trying to defend the pain I was feeling during sex to this man who really couldn't care less. It was awkward and humiliating and made me feel like I was making a big deal out of nothing despite how scared I was. And when the pain didn't go away for a few more weeks, I went back to my normal doctor in tears talking to the intake nurse because I was convinced it was something terrible. My normal doctor listened, did an exam, and took a look, and felt around, and discovered I had a cut/tear in my vaginal canal, and told me it wasn't dryness, it was caused by sex. Sometimes the skin tears during vigorous sex, not abnormal but can cause the pain and bleeding, and the semen getting into the cut can sting. I was directed to abstain and use a healing ointment like Aquaphor until it healed. I did and it worked, and I'm so grateful. She listened and did an actual exam. I'm so sorry you went through that. Getting blown off by doctors is a disappointing feeling, but when it's lady issues it feels even worse by a male doctor. A really invalidating experience. I'm glad your regular doctor took you seriously and got you all better. I was a freshman in HS, and I went to a normal yearly physical. It was a new small office in a new location and the desk person was a girl who went to the same HS as me. I brought up to drive that I had a small lump in my sack. The physical continued, and he showed me his new work toy. It was a speech-to-text microphone that was connected to his laptop. Patient complains of a small painless lump inside the scrotum. It wasn't working, right, so he tried again. Louder. Patient complains of a small painless lump inside the scrotum. I guarantee the whole office heard him. No eye contact was made with said desk gal leaving the doctors that day or in the halls of school ever again. Where I live, you have to have proper qualifications to work as a receptionist in any medical field. It's wild to me that a doctor's office would have a high school student at the front desk. Lol. This was most recent embarrassing doctor visit, as I've had pretty terrible luck with medical professionals in general. I had a recurring/constant ear infection for probably around 8 months last year. I did it a Levasid with a new primary and he prescribed antibiotics and said if it didn't clear up that I'd have to go to the ENT. I finished the round and my ear cleared for a little bit, but then returned to fully messed up. Ended up on another round of antibiotics for an unrelated incident, and same story. We have long wait time for doctors and specialists where I live, so many months after my ear infection had started, I go to the ENT. He takes one super quick look in my ear and leads me to another room. He has me lay on my side and pulls out a hearing aid dome that apparently had fallen off and gotten stuck in there. He also waited to pull the thing out before telling me what the problem was. I'm guessing for the drama/amusement factor. I was embarrassed since I had lost a dome, but figured it had fallen out somewhere and not into my ear. The timeline of the two incidents never connected for me, so I never pieced it together as an option for what might possibly be wrong. He tried to reassure me that it happens pretty often, but then he had to throw in that usually it happened to elderly patients, and I was probably the youngest person he had pulled one out of. All this could have been avoided if I didn't have a damn telehealth appointment in the first place. Thank you very much for watching. I hope you enjoyed the video. Please subscribe to my channel for more curated daily Reddit stories.